When it comes to COVID-19, Cynthia Lanzoni takes social distancing very seriously. Since March last year, she has been working from home and has avoided going out unless necessary. This has taken a toll on her mental health, something her teenage daughter first noticed.
Está triste? Eu falei, não, é uma tristeza, é um momento muito difícil, tá todo mundo triste.
I thought I was only sad, and that it was normal, because everyone is sad in this pandemic. I did not accept I was getting depressed. But then my daughter said, "Mom, you have not been sleeping, you have not been eating, you only shower every 2 days because I tell you to do so. You are very aggressive when I speak to you. That's not normal. Normal sadness is something else."
Cynthia went to see a psychiatrist and became part of a growing number of people who needed antidepressants and mood stabilizers to cope with the pandemic. According to Brazil's Federal Pharmacists Council, sales of prescription meds grew by 17% in 2020.
Mental health problems caused by the coronavirus pandemic have not only been linked to an increase in prescription drug sales in the country, but also to a surge in patients at public mental health care centers, with people seeking help to cope with the health crisis.
The supervisor at the center says numbers would be even bigger if people didn't feel a social stigma about asking for help.
Felizmente ainda nós temos algo que se enquadra praticamente como uma psicofobia. As pessoas
People often resist seeking help because they are afraid of being seen as crazy, as someone with a big problem that will last 4 years and incapable of working. It's important to correct these misconceptions when it comes to mental health.
Então tem esse clima de medo.
One problem is the atmosphere of fear. People are afraid to catch the disease. And another problem is that many people lost their loved ones to COVID-19. They lost friends, relatives. So there are many people saddened by this.
Social distancing has proven an effective way to protect people from COVID-19, but doctors warn there's also a mental component that needs to be treated and cared for. Paulo Cabral, CGTN, São Paulo.